Good evening to my and welcome to my website www.painfreepartha.com. Freely downloadable, editable. You can download the slide of barbiturates, you can download the slide of propofol, you can download the slide of CABG and change it to your name and percent. Everything is free and editable. And also visit my YouTube channel Pain Free Partha. Today's topic is about augmented reality and virtual reality in anesthesia training. Whenever I talk anything on academics, a good salute to the legendary teacher of 2 centuries, Professor Ravi Shankar, and he is the director of Seedlings of Mahatma Gandhi Medical College and Research Institute, Pondicherry, India. What is this augmented reality? Okay, it means adding a computer generated image or an information into a real world in real time. You are seeing something really and you are adding some computer images instead of replacing reality. The reality is not replaced, it is there, but it adds computer images, it adds some digital information. This is what is called augmented reality. Now you simply see, you are seeing a phone camera. Okay, when you point the camera at the patient mannequin here and the mannequin is seen and AR adds the airway, AR adds whatever the sinuses, all these things, veins, nerves. This is what is called augmented reality. So you are seeing the phone camera, you should see only the mannequin. Now you added an AR. So this shows your airway. Now you can see this shows you are seeing an intubation. This thing you are putting this thing here, and the mannequin is seen, but you can also see this intubation. This is what is called. You can see the airway inside. So where the reality is augmented, there is a reality. There is something because there is a mannequin, and you are seeing the phone camera, and the road is seen. The arrow is showing where to turn. Building is seen top street labels. Junction navigates. A regular map is not an AR, but you can see the view with cameras, arrows. All this means it is augmented reality. Now, what is virtual reality? Virtual reality means there is no reality at all. It is everything is virtual. For example, you are wearing a goggle. You are not seeing the camera. You are not seeing the cell phone. You are wearing a goggle here, and you can see something coming and something coming, and you can see that, for example, after the camera, the mannequin will be here, and you can see the intubation like this. Okay, so a medical student wears a head, he enters the virtual operation theater. The virtual patient appears. He practices CPR. He practices intubation. That is what is called virtual reality. There is no reality at all. It is not augmented. Everything is virtual. Now, augmented reality means digital information to the real world, complete virtual world. Real world is blocked, full computer generated environment. You need VR headsets, you need AR glasses. Google Maps, live videos, virtual reality stimulation headset, nerve mapping, airway guidance may be there. Interacts with real surroundings, virtual world. That is the difference between AR and VR. Now, what we know is what is AR and what is VR. Okay, early VR systems in 1960s and mainly research based. Now VR has developed even for 4,000 rupees. VR developed in 2010s like August refilled HTC Vive, advances in displays, motion tracking, etc. Now VR in airway, a 3D visualization. He puts a goggle and there is some mannequin appearing in the goggle here. There is no mannequin. It appears. Now he starts intubating this. CT-based virtual airway models aid planning. It helps select appropriate intubation techniques. So this is what is VR in airway training. You have a 3D visualization without any patient risk. Yes, CT-based airway model. Now, after that, you can see that this is the best intubation methods. I'm going to do a fiber optic intubation only for this case. Like this, you can choose the best intubation method. Yes, VR supports bronchoscopy guided intubation. Difficult scenarios cannot intubate, cannot ventilate, and enhances fiber optic bronchoscopic skills. Anatomical variations. If a post burns contracture neck, you can see a VR, and it also measures intubation time and success rate. Yes, we can do it within 15 seconds, and we can use it, and in VR 99% success. So all these things are possible. Airway training, bronchoscopy training, fiber optic training, difficult airway training, cannot intubate, cannot ventilate training, fiber optic training, everything. Now we can see beautifully the goggles wearing this extended this thing, and you can easily intubate. So this is airway training with AR and VR. Now nerve block training. VR improves nerve block skill training. Now you can see there is nothing. Just he puts the goggle here. And he puts the goggle here, you can see the muscular nerve, pterygoid fossa, inferior alveolar nerve, all these things, and he puts the scan and sees the nerve and pricks. But actually, nothing is there. Everything is virtual in this goggle. So you can see, you can train your needling pathways, you can train your ultrasound skill in this VR. Yes, it can be used for epidural anesthesia, common in obstetric delivery, traditional palpation methods. Yes, we cannot see. VR uses lumbar ultrasound image guidance. Accuracy 85%. You can improve your puncture skills. Yes. Limited, yes, dependence on limited teaching resources. For example, only one faculty is there, 10 residents are there, 15 PGs are there, 3 faculty is there. Sometimes active faculties who are teaching, like sometimes. So VR can be used. We are training for, you put the goggle here. Yes, you can see the ultrasound image. You can see everything spinal. What is haptic feedback? This is very interesting in VR. For example, you are put the goggle here, okay? You are putting this needle here. As soon as there is a facial click, there is a sound here. You can hear the sound. This is what is called haptic feedback. You can feel the pierce. There is something which tells there is a vibrating is there, there is ligament temporum is prick, all these things. The touch feedback is called haptic feedback. VR for physicians is there, VR for patients is there. Yes, we can train patients in pain, yes, simulate patient pain scenarios safely. Yes, we can safely simulate a lumbar epidural pain, sciatica, all these things. For example, glossopharyngeal neuralgia. Yes, improving clinical skills and decision making. But for also patients, yes, what I'm going to do, I'm going to do a lumbar epidural, I'm going to do a sciatic nerve block, all these things, yes, they can find out previously. I'm going to do a stellate ganglion block, I'm going to do a here sympathetic block. For physicians and for patients, distraction during procedures beautifully. Here you can see reduces patient anxiety, improves comforts. We can easily put the celiac plexus block. Yes, assessment is there. Select VR intervention. VR delivery and outcomes are always better. We can do in burn stressing. Yes, the patient can see what we will be doing. Injections and venipuncture, especially for kids. Dental procedures, chronic pain management, labor and support delivery. All these things VR is helpful for physicians also, for patients also. We are in telemedicine, remote supervision, and robotic remote surgeries. Yes, inconvenience of traditional medicine practice reduces medical accident due to unskilled operation. Make it skill. We are also improves patient communications, understand anatomy and treatment plans, patient satisfaction and health awareness, communication skills. Yes, for example, you put a VR and the patient starts talking. You talk, he talks, doctor talks. The different way of talking. All these things can be virtually simulated. The patient is planned for spine surgery. Wears a VR head. Now he will know what the surgery is done. A patient wears the VR set and how he will go to the pre-op room. From there, how he will bend like this for a spinal. All these things he will see the day before. We are in doctor-patient communication. We are experienced in spinal anesthesia. Operating room crisis also is scenarios. Real-time emergency training. For example, you put a VR. Now there will be a mannequin which goes into arrest. Yes, we do CPR, we inject adrenaline, and again see the carotid pulse. All these things are beautifully trained by VR, useful for bypass training. Even in non-technical anesthesia skills, the leadership skills also can be trained by VR. Cardiac tamponade, last scenarios, fire emergencies, mass casualties, everything you can train it by VR. Yes, we can do CPR, we can do intubation with goggles. That is VR. We can see a scenario of hypotension. We can see the heart rate coming down here. The person is ventilating and the patient is giving a shock. What is metaphors training? Now you see this. A resident is in Chennai and the faculty is in Delhi and a student in London. All enter the same virtual operating room and practice a difficult airway together. See, the fellow is in Chennai, there is in Delhi, he is in London. All these things, they enter the virtual operation theater and he gives the training. They listen. So this is very simply called as metaverse in anesthesia training. Yes, it is safe, reliable, interactive integration possible. VR is not only improving skills and improves traditional teaching also. Range of development is limited. We cannot go into so many blocks, anti-tennis block, all these things. Range is, yes, we can do an accelerated breaker. Development of hardware and software is an important condition. Maybe less resource setting, it is less useful. Augmented reality and virtual reality are transforming modern anesthesia education. Immersive, and repeatable training. That is very important. They go into that and train. They can train again. Morning one training, evening one training. That is not possible. A difficult airway can be trained with him. Yes, competency based curriculum. Final message: practice in virtual environment today can improve patient safety in the real world tomorrow. Thank you very much. Visit my YouTube Pain Free Partha, subscribe, listen, and enjoy. Thank you.